before I give a floor to Dr. Ryan, just to remind you that we will have audio file from this press briefing immediately available with a couple of links to news that have been issued by different WHO offices, as well as advisories for media briefings that will be held by our regional offices. So you will get that after the briefing. Now I give the floor to Dr. Tedros.
Thank you. Thank you, Tariq, and I would like to join Tariq in apologizing for the delay. Good morning, good afternoon, and good evening, wherever you are. As we enter the fourth month since the start of the COVID-19 pandemic, I'm deeply concerned about the rapid escalation and global spread of infection. Over the past 5 weeks, we have witnessed a near exponential growth in the number of new cases, reaching almost every country, territory, and area. The number of deaths has more than doubled in the past week. In the next few days, we will reach 1 million confirmed cases and 50,000 deaths. While relatively lower numbers of confirmed cases have been reported from Africa and from Central and South America, we realize that COVID-19 could have serious social, economic, and political consequences for these regions. It's critical that we ensure these countries are well equipped to detect, test, isolate, and treat cases and identify contacts. I'm encouraged to see that this is occurring in many countries despite limited resources. Many countries are asking people to stay at home and shutting down population movement, which can help to limit transmission of the virus, but can have unintended consequences for the poorest and most vulnerable people. I have called on governments to put in place social welfare measures to ensure vulnerable people have food and other life essentials during this crisis. In India, for example, Prime Minister Modi has announced a $24 billion package, including free food rations for 800 million disadvantaged people, cash transfers to 204 million poor women, and free cooking of gas for 80 million households for the next 3 months. Many developing countries will struggle to implement social welfare programs of this nature. For those countries, debt relief is essential to enable them to take care of their people and avoid economic collapse. This is a call from the WHO, the World Bank, and IMF, debt relief for developing countries. 3 months ago, we knew almost nothing about this virus. Collectively, we have learned an enormous amount, and every day we learn more. WHO is committed to serving all people everywhere with the best evidence to protect their health. WHO develops guidance based on the totality of evidence collected from around the world. Every day, our staff talk to thousands of experts around the world to collect and distill the evidence and experience. We constantly review and update our guidance as we learn more, and we're working to adapt it for specific contexts. For example, we recommend hand washing and physical distancing, but we also recognize this can be a practical challenge for those who lack access to clean water or who live in cramped conditions. Together with UNICEF and the International Federation of the Red Cross, we have published new guidance for improving access to hand washing. The guidance recommends that countries set up hand-washing stations at the entrance to public buildings, offices, bus stops, and train stations, and many countries are doing it. We're also working hard with researchers all over the world to generate the evidence about which medicines are most effective for treating COVID-19. There has been an extraordinary response to our call for countries to join the Solidarity Trial, which is comparing 4 drugs and drug combinations. So far, 74 countries have either joined the trial or are in the process of joining. As of this morning, more than 200 patients had been randomly assigned to one of the study arms. Each new patient who joins the trial gets us one step closer to knowing which drugs work. We're also continuing to study the evidence about the use of masks. WHO's priority is that frontline health workers are able to access essential personal protective equipment, including medical masks and respirators. That's why we're continuing to work with governments and manufacturers to step up the production and distribution of personal protective equipment, including masks. There is an ongoing debate about the use of masks at the community level. WHO recommends the use of medical masks for people who are sick and those caring for them. However, in these circumstances, masks are only effective when combined with other protective measures. WHO continues to gather all available evidence and continues to evaluate the potential use of masks more broadly to control COVID-19 transmission at the community level. This is still a very new virus, and we're learning all the time. As the pandemic evolves, so does the evidence, and so does our advice. But what doesn't change is WHO's commitment to protecting the health of all people based on the best science, without fear or favor. I thank you.
Thank you very much, Dr. Tedros. We will now open the floor for questions. I will just remind you that we will try to keep one question per person, so we try to get as many as possible. As we were late, we will not be able to stay very long. So let's start first from Italy. Giulio from Rai. Giulio, can you hear us? Can we try one more time? For Italy, Giulio, Gianmaria. Okay, we don't have a Giulio online. We may try to come back to him. Let's try to Jamil from Brazilian media. Jamil, can you hear us?
Yes, can you hear me, Tarek?
Yes, Jamil, please go ahead.
Perfect. Dr. Tedros, thank you for taking my question. Yesterday, especially, President Bolsonaro has misused your words to justify his policy in Brazil. My question to you, what is your message to the Brazilian people and to the Brazilian leadership? Thank you.
I think the message that WHO is giving to all countries is that we need a comprehensive strategy to respond to this disease. We need, in addition to any measures around lockdown, we need to put in place a comprehensive strategy based on surveillance, on public health intervention, case detection, testing, isolation, quarantine, and strengthening our health systems to absorb the blow, and the blow that many health systems around the world have had to bear over the last number of weeks, which has been a tragedy for all those caught up in it. It's really, really important that all countries take this seriously, get ready, prepare their health system, strengthen their public health architecture, engage their communities, educate communities, and bring communities on board and bring and leave no one behind. And I think this is advice we're giving to all countries, not just Brazil.
Thank you very much, Dr. Rand. We will try one more time with Giulio from Italy. He was on mute. Apparently, Giulio, are you available now? Giulio, Gian Maria, can you unmute yourself? Well, apparently it is not working, so we will move on. We'll move to Stephanie from Reuters. Stephanie, can you hear me?
Thank you. Yes, can you hear me?
Yes, please, go ahead.
Thank you very much. Perhaps a question, a data question, perhaps for Mike. China has now disclosed that it's, the number of asymptomatic cases, and that they're not counting it in their